Hey guys, in this video, I'm just going to focus really specifically on nerves, their structure, and then having a look at some of the major plexuses in the body. So with the nerves, right, remember we're always going to be in the peripheral nervous system when talking about the nerves. We can think about them as our transmission lines, but they are bundles of axons, and those can be either myelinated or unmyelinated. And so what you're seeing here is an image from a scanning electron microscope showing the superficial features of a nerve. And so everything in red here is showing the axon. The white is showing the myelin surrounding that axon. And then you can easily see the connective tissue that is wrapping around not only the myelin, but also wrapping around these bundles of axons, which are going to be called fascicles. So these nerves are going to be the transmission lines in our peripheral nervous system. Most of them are going to carry both motor as well as sensory information. The rarities are the ones that are either only motor or only sensory. First of all, just to cover some key anatomy, what you're seeing here is a graphic depiction of a nerve. And again, bear in mind that the axon is really only a small percentage of the nerve's bulk. It includes all of this connective tissue. It includes these blood vessels. So starting deep and working superficially, you have the axon of a single neuron. It's going to be surrounded by myelin. And recall that myelin is going to be laid down by Schwann cells in the peripheral nervous system. Around the myelin, so encapsulating the Schwann cells, you will have this first layer of connective tissue called the endoneurium. Then you have this organization very similar to muscle organization, where these axons bundle into what are called fascicles. Those fascicles are then going to be surrounded by the periscope to go around the perineurium. So that's what you're seeing here and here and wrapping around this guy. And then encapsulating the entire nerve is going to be the epineurium. So epi, again, meaning surface. So that's going to be wrapping all the way, getting all the fascicles as well as the blood vessels. So each and every spinal nerve in the body is going to connect to the spinal cord via roots, spinal roots. So you have dorsal roots, you have ventral roots. And just as we saw before in another video, it's going to continue to be the case that the dorsal side of the spinal cord is going to carry or contain sensory information. So sensory input is going to come in through these dorsal roots, and then on into the dorsal spinal cord. Similarly, motor output, these efferent fibers are going to travel through these ventral roots through here. So just some general organization. And then a plexus is an interlacing network of nerves. So there are 4 major plexuses that I'm going to highlight in this video, and I'll do my best to really draw your attention to what I want you to know for the quizzes. So the cervical plexus, to start us off, is going to run C1 through C5. So as it says here, most of these branches are going to innervate the skin of your neck, the back of your head, your ears, but then you also have branches that are going to innervate the neck muscles as well. One of the key nerves that I'd like you to be aware of is the phrenic nerve here. So it's coming from between C3 and C5. And this phrenic nerve is significant because it innervates your diaphragm. And so one of the reasons that spinal cord injury at this level, at the cervical level, or fracture of the vertebrae here can potentially be lethal is that if it damages this phrenic nerve, you've now lost voluntary, or rather just control in general of your diaphragm. And so that's going to affect your breathing and could be deadly. On a lighter note, irritation of the phrenic nerve is what causes hiccups. The brachial plexus, so gives rise to nerves that innervate the entire upper limb. So the brachial plexus comes from C5 to C8, all the way down to that very first thoracic vertebrae. And this plexus tucks under your clavicle. So sometimes injury can be inflicted upon this plexus if you have a situation where your shoulder is pulled away from your neck. Sometimes at birth, if a baby is born and their head crowns, but their shoulder is impinged and maybe forceps have to be used to get them out. One risk is injury to this plexus. Motorcycle accidents, bike accidents where somebody lands on their shoulder and it forces that stretch can cause damage to this plexus as well. So to look a little bit more about some of the key nerves that make up this plexus, so I'd like you to be aware of the ones in bold here. So you've got the axillary nerve, the median, the ulnar, and the radial. So just some fun examples of irritation to these plexuses. If you think about the funny bone, right? One of the reasons that it can be so aggravating to have your funny bone hit is this, the ulnar nerve runs right past that condyle of your humerus. And so when it's hit, it can ping that ulnar nerve and cause irritation. Similarly, you can irritate the axillary nerve if you use crutches and have the weight of that crutch going up into the armpit as opposed into the muscles of your arm. That can cause irritation or damage through here, as well as numbness. When that nerve is pinched and deprived of blood flow for a period of time. Anytime a limb falls asleep, what's really happening is a nerve is being impinged in a way where blood flow is reduced, and nerve feeling will come back as well as soon as that blood flow is relieved. And then another clinical example with the median nerve, which you can see right here, is carpal tunnel syndrome. So if the median nerve is compressed, then you can have numbness going into your fingertips. So that's the brachial plexus. Lumbar plexus, so as the name implies, we are in the lumbar region now. So this is going from L1 to L4, the first through the fourth lumbar vertebrae. And you see that the various nerves from this plexus are going to innervate or stimulate muscles in the thigh, the abdominal wall, as well as the psoas, that deep hip flexor, one of the major deep hip flexor muscles. And among these, the one I'd like you to be most aware of is the femoral nerve here. So the femoral nerve is going to innervate your quadriceps. So it's going to be responsible for knee extension and flexion at the hip as a consequence of that. It's also going to serve the skin or the superficial part of the front of the thigh, the anterior side of the thigh, as well as the medial surface of the leg. So that's our femoral nerve right here. Sacral plexus, so getting into the sacral region now. So starting from L4 through S4, so serves the gluteal muscles, lower limbs, pelvic structures, and the perineum. The one I'd like you to know here is going to be the sciatic nerve. So one that I'm sure you all have heard of. So it's the longest nerve in the body. It's also the thickest nerve in the body. And it's going to innervate the backside of your leg. So the hamstring muscles, the adductor magnus, and then it extends all the way down to your leg and to your foot. The piriformis is a muscle that in some individuals, this sciatic nerve actually may go through the piriformis or may run just directly juxtaposed to it. So sometimes irritation in that muscle can lead to issues with the sciatic. Somebody might have a loss of sensation that may extend all the way down to their foot. I also know that with pregnancy, oftentimes an individual experiences more pressure along that sciatic nerve, leading to issues or pain in particular going down the backside of their leg. Another clinical example that I forgot to mention is that when somebody has a herniated disc, sometimes that can compress roots of the lumbar plexus, and it can lead to gait issues in some individuals. So, just a really quick overview of some of the key plexuses in the body. Again, we've got the sacral, the lumbar, the brachial, and the cervical. Thanks, guys.